Are you already on Wikisana?
Dear viewers, welcome to our today's format, Visite. And at this point, thank you for the many lovely letters. And I've chosen one right now, also today, from Ingeborg. Ingeborg, you write to me that you are 75 years old and that you are now getting to know me through your niece, Bettina, who was treated by us. And you have attached findings to me that contain the diagnosis as a result of a subendocardial myocardial infarction, i.e. a heart attack. And you have written to me that you are turning to me, although you are a bit helpless at the moment due to the strong side effects of the medication. What you should be doing now, you have actually reduced the medication on your own. You came home after the heart attack and were on a rollator for several weeks. Then you had a 5-week rehab stay. And the drugs prescribed there, of course, I have them here in the list. You have reduced all the medication except for Marcomar, the blood thinner, and are now taking Strovantin Ertincture, 3 times 20 drops. And it would be your wish that I take a look at these things. With the question, now I would like to know from you, which supportive herbal medicines, food supplements, or the like you recommend to me to strengthen my heart performance. I very much hope that you will comply with my request and so on. Yes, dear Ingeborg, let's see. The first thing I wanted to tell you is, you spoke a bit of a lack of confidence, but the colleagues have already saved human life quite well. Please don't forget that. No, of course not. A very cardiologically specialized setting has been used here, i.e., due to the infection after the heart catheter, due to the rhythm disturbance, due to the normalization of the rhythm, due to the measures that are being read here like a crime, of course, a serious situation has also arisen from this. You can't put it any nicer. And within the framework of the medicines presented to an internist, he only has his spectrum. He hardly goes beyond this spectrum. Therefore, of course, you have continued to be self-reliant, and that is very brave and also very smart for my terms. But maybe we should understand this again piece by piece. The first thing that is actually necessary is that you know that the heart is an organ that is equipped with an equally high level of nerve stimulation, like our brain, for example. We have so many receptors in the heart that regulate stress hormones. The heart is receptive and feels much earlier whether it feels the empathy of a person or the rejection. That is why it is very important that you face life with an incredible great warmth of heart, but also love for yourself, love for life and love for the time of life that you have lived with 75, of course, in the perspective of what you were allowed to experience. I think this is very important, because any stress, any tension, causes a blood clot in the heart. The body, of course, as part of its autonomous nervous system, needs so-called regulators, like measuring instruments, to constantly feel like oxygen every day. Do we have enough oxygen? Do we have enough magnesium? Do we have enough mineral salts? Do we have enough acid? Do we have enough alkalis? All of this has to be perceived through the body in a certain balance. The red blood cells, the white blood cells that transport oxygen, are essentially dependent on how well you are doing, how you think and how you feel. All of this has an influence on whether I am a little toothless, whether I am controversial, or whether I am in great peace with myself and my body. This is very important for heart health. The other thing is that, of course, the heart should be examined in terms of circulation. These parameters are responsible, not just for LDL. LDL is a transport protein that transports cholesterol to the cells because it is needed in all cell membranes. It is needed for the production of vitamin D. But on the other hand, if this LDL comes into contact with high radicals, with oxidative stress, it can oxidize itself and cause plaque, inflammation, atherosclerosis in the cells, or rather in the vessels. So not the LDL is important in monitoring, but the oxidized LDL. The other parameter is HDL, the high-dose lipoprotein, which brings cholesterol back to the liver for recycling. It is a constant back and forth, not good or bad. Both are important in their function. HDL is significantly triggered in its high transport function when you move nicely. That means when it is important for you to go for walks, to do a little water gymnastics, when at the age of 75 many things are important to you in everyday life. You go up the stairs, you go shopping, maybe once by bus and once by foot. So all things that promote heart health in everyday life. When we talk about atherosclerosis, then please do not think of cholesterol, but of homocysteine. Homocysteine is a parameter that is essentially responsible for metabolism, which then indicates, when it is increased, that vitamin B12, folic acid and vitamin B6 are not in the balance. It is so easy to bring this atherosclerosis factor back to its balance very quickly. And from maybe 100 people between 70 and 80, I see a vitamin B12 deficiency at 80%. That is why it is very important to have a high, good vitamin B12, but also folic acid and vitamin B6. And the third one, in the context of a good heart infection at this point, is a new parameter, which is not yet medically known. Namely, there are bacteria in the intestine that develop the so-called key metabolite. And this key metabolite is the TMA of trimethylamine. This trimethylamine gets to the liver, where it is then oxidized. And this then developed TMAO, this oxidized product, can be chemically observed in the laboratory. And today we know that it is responsible for circulation disorders, that it is responsible for fatty liver, for insulin resistance, but also for an increased thrombosis tendency and for a generalized atherosclerosis. These are parameters that are available in some laboratories, both in urine and now quantitatively, the TMAO analysis in the serum. But let's get back to your question. I think it was only at that moment, at the heart, to see its circulation well in equilibrium. But let's get back to the question of what can actually support the heart. And when you talk about strovantin, then of course it is a plant-based product, which for many, many decades was the remedy for all cardiovascular diseases of the first wave. Until then, chemically, the digital products were produced and then strovantin really drifted a bit into the corner and no longer allowed it. Today you don't really want to have this African climbing plant either, but there is a so-called strovantin pharmacy, which produces both the H and the G and the K strovantin, in 3 milligrams. This strovantin in the most diverse form activates the parasympathetic. And we have often talked about parasympathetic. This is the great balance, the autonomous nervous system that unconsciously adapts to life, which ensures a certain tension, but also always ensures a good relaxation. And everything that is associated with relaxation means that the heart is open, the cardiovascular vessels are wide, the blood pressure normalizes, the circulation is optimal, because the whole system is oriented towards regeneration and health. And that's exactly what strovantin does. It steers the programs in the direction of a strong parasympathetic. It relaxes and reduces the activity of a highly self-regulating stress program to a decent level. This is of course relieving for the heart, that the heart does not have to pump against a resistance when there is high blood pressure. Therefore, people who now have high blood pressure, who may not be treated optimally or who do not know for a long time that they have high blood pressure, have an enlarged heart. Because if the heart against a high blood pressure, the blood is a big, I would not say, it is not the pump that stimulates the circulation. We have known that for many, many years. But it ultimately ensures, within the framework of its pumping process, to constantly absorb the preload and to pass it on to the body. And in this moment, when, of course, relaxation is there and the blood pressure normalizes, the heart can work with an optimal heart performance. If it constantly works against a pressure, the heart muscle mass increases or thus the heart size. One then speaks of a heart hypertrophy. On the other hand, I would say, the heart muscle through circulation is significantly improved and thus, of course, also the microcirculation. So to a heart attack it comes only when, through the 1,000 small capillaries, not enough oxygen comes to the heart cell. That means, this microcirculation is opened, because with it also the oxygen absorption for the heart cell opens, and thus, of course, also the blood flow, the pH regulation and so on, these things are optimized. And that's why, of course, there is use for high blood pressure or for all heart and vessel problems. And, of course, especially in the framework of a pre-heart attack, it can significantly prevent a heart attack. And on the other hand, of course, after a heart attack, if the heart is still well burdened, then it is also needed. And in the moment when it is needed, more and more new capillaries begin to form, which then ultimately neutralize this defect, or rather continue to bridge this defect and thus continue to improve the heart performance. So strovantin is already an incredibly valuable drug in the truest sense of the word, but also exclusively on a plant-based basis and should not be forgotten in any way. Please do not only think of strovantin at the moment, but please also think of Consignment Q10. This is the motor for mitochondrial energy production. Every heart cell has so-called heart cell energy power plants. We have already talked about this several times, which, of course, are not only in the heart cells, but in every heart cell. But these energy power plants are essentially responsible for making a cell strong by having a strong energy change. And a heart cell has far more energy power plants than any other muscle cell. We are talking about 1,000 to 1,500 in the heart, from 3,000 to 4,000. There is no tumor disease in the heart, as well as no cancer disease in the heart, because a cancer disease has something to do with the mitochondria, with the energy power of the cell. This is very important. L-carnitine is also very important for heart energy production. And on the other hand, NADH. These are all cofactors for the energy change in conjunction with B vitamins and magnesium. Magnesium citrate or orotate is good for the heart. You usually cannot overdose with magnesium, but please take magnesium every day in conjunction with potassium. And to get a real look at whether the heart is well supplied with potassium, I would ask you to measure the potassium value. Potassium and magnesium in blood, but in full blood. This is the important difference, because these are vital minerals that are needed in the cell, and therefore not only measured on the serum, but really intracellularly through full blood. If you want to do even more good for the heart, then make sure that there are no inflammations in the vessels. That means, please always think of tocotriol or tocophenol. This is vitamin E 400 mg a day, a capsule or a capsule to 2 of the vitamin E complex. And the second is omega-3. The large unsaturated fatty acids, about 3,000 mg a day. And that can be supportive in everyday life, in addition to the capsules of fish oil. There are also vegan variants. But here you can significantly reduce the intracellular or the inflammatory factor, to put it better. And I think that would be all from my side. So you will not be able to do a lot of good for the heart on the one hand, especially in the context of the infection. With this, there was certainly a burden on the intestine, which also antibacterial. Of course, it was quite a burden for him. Please always think of the effective microorganisms at that moment. A very nice product is Microvida. Because the effective microorganisms are, if they are strong and have the upper hand, then they can regulate a microenvironment very nicely again to your liking. I think, dear Mrs. Ingeborg, these are very good tips. And then I think you have a lot of good to give to the heart in the future. Because if you care so lovingly for your heart, then your heart will contribute to it very reliably in the future. I would not change the Marcoma intake, this rhythm disturbance, which was really a tachyarrhythmia. Please do not change that. But these are not long-term therapies, but please stay with it for the next few months. Because the heart also has to be cardiologically monitored in the context of its rhythm. And in the context of the metabolic parameters, which enable a good circulation, I think that in the future you can either switch from the Marcoma to aspirin, or there are of course also herbal anticoagulants. And I may only remember the nattokinase, but I would definitely not recommend it at this moment. First of all, get back into good stability. I hope the rollator has been put aside for a long time. Please greet your dear niece from the bottom of your heart, Bettina. And yes, in this sense I am happy and thank you very much for your admission. I still have a little bit of time. And a little tip from my side, maybe at the end of the broadcast. There is a so-called dermatophyton. This is a fungus, a foot fungus. And many people have a lot of worries with this nail fungus. This onychomycosis is also called medical. You can actually do quite well. You know that a fungus disease always requires prerequisites. Today we see toxic stress with fungus stress in a large group, so I would appreciate that very much on the other hand. If you also go after this thing. Toxic stress, I mean that the toxicity in the organism, whether it is mercury, cadmium or silver and aluminum, and also this excretion process, maybe have a look at it. And then maybe increase the need for selenium. If you measure selenium intracellularly and then take selenium, 100, 200, 300 micrograms, then the body can act and excrete very differently intracellularly. Or zinc. Zinc is also measured intracellularly in full blood. This means that these are two very, very valuable minerals or trace elements that improve excretion. In connection, of course, also with chlorella or zeolite. Toxoprevent. A bag stirred up in water in the morning and evening, but with a wooden spoon. On the other hand, the chlorella is highly dosed. 3 times 10 to 15 tablets. I often do it alternately. 1 week of chlorella, 1 week of zeolite. That binds, leads out. But propolis. Propolis, for example. Propolis is the bee's chitin. It is important that you clean your feet properly every day. With soap and then 2 drops of this propolis extract. Please put it on the nail. Put it nicely into the nail. My experiences are more than positive. In this sense, I wish you a very, very nice week. Thank you for all this attention. And I'm looking forward to next week, if you like. Just send me an email. If you want a medical advice from a holistic point of view, then please go to visite-at-qs24.tv. I like to look at it and then choose from the entries, of course, which topic we can discuss here as well. Until then, I wish you a very good time and look forward to the next visit with you. Goodbye.